Entropion. This is me, Dr. Hatem, Khattab, a consultant, ophthalmologist, Zagazig, University of Egypt. Bismillah ar-Rahman ar-Rahim. Entropion is rolling in of the lid margin. This is the linguistic origin of this term. اللغة العربية اسمه الشطر الداخلي. As concerns the etiology of entropion, if we go back to basics, the eyelid functionally is divided into the anterior lamella, including the skin and connective tissue, and the orbicular oculi muscle, and the posterior lamella, including the tarsus and the conjunctiva. This is a photograph delineating the principle of the anterior and posterior lamellae. Another photograph of the anterior and posterior lamellae of the eyelids. And this is the last photograph of the anterior lamella and the posterior lamella of the upper and the lower eyelids. The golden rule: any disease causing posterior lamellar shortening produces entropion. Exactly like what occurs with these rubber bands, or like the contraction of the skeletal muscle. Regarding the clinical types of entropion, it may be a congenital anomaly and may be acquired. The acquired may be involutional or senile, may be cicatricial, and may be spastic. The congenital form is to some extent rare. It is due dysgenesis of the lower eyelid retractors or developmental abnormality of tarsal plates, sometimes associated with microphthalmos. This is an example of a congenital entropion with microphthalmos. Another example of congenital entropion. A third example of congenital entropion. Sometimes it may be involutional or senile. This is the linguistic origin of the term involutional. Involutional entropion is age-related condition mainly affecting the lower eyelid. Age-related degeneration of elastic fibrous tissue within the eyelids, resulting in the following: horizontal lid laxity caused by stretching of canthal tendons and tarsal plate. This is a test of horizontal lid laxity assessment. Vertical lid instability due to disinsertion of lower eyelid retractors and overriding of the pretarsal by the preseptal orbicularis. This is an example: lower eyelid involutional or senile entropion. Another example. A third example. A fourth example. Cicatricial entropion. Cicatricial is related to the term cicatrix or scar. It is due to cicatrization of the palpebral conjunctiva and deformity of the tarsus. For example, due to trachoma or conjunctival pearls. There is a long list of diseases and disorders causing chronic cicatrizing conjunctivitis. It may affect the upper or the lower eyelids. This is an example of cicatricial upper eyelid entropion due to trachoma. The right photograph of the conjunctiva delineates the scarring occurring in the sulcus subtorsalis. This sign is called the Arlet's line. Another example of cicatricial upper eyelid entropion due to trachoma with Arlet's line. A third example of the same condition. This is an upper eyelid cicatricial entropion following a chemical purge. The spastic entropion is caused by spasm of the muscle of Friolen due to irritation, for example, due to conjunctivitis, keratitis, or a foreign body. Plus, lack of support of the eyelids by the globe. For example, in enucleated eyes and in atrophia pulpi. Concerning the symptomatology of entropion, the patient complains of ocular pain, blepharospasm, lacrimation, photophobia. In brief, these are corneal symptoms due to secondary traumatic corneal ulceration. Plus or minus cosmetic problem. As regards the grading of entropion, only the posterior lid border is rolled in, this is grade 1. If the intermarginal strip is rolled in, this is grade 2. If the whole lid margin is rolled in, this is grade 3. Concerning the possible complications, recurrent corneal abrasions, superficial corneal opacities, corneal vascularization, and non-healing corneal ulcers. As concerns the differential diagnosis, the congenital form should be differentiated from epiplefferon, which is a condition in which the eyelid muscle and skin rise above the eyelid margin to form a fold of tissue that causes the cilia to point upwards. It's most commonly seen involving the lower eyelid. It is a congenital condition and commonly seen in Asians and Hispanics. The second disorder that should be differentiated from entropion is distichiasis. The last disorder that should be differentiated is trichiasis. Concerning the management, it varies according to the etiology, the severity, the presence or absence of complications, as well as the surgeon preference or choice. There are guidelines. No fixed technique or maneuver could correct entropy. We have some non-surgical measures that can aid in many cases. Artificial tears or tear substitutes in the form of eye drops and eye ointments. Soft contact lenses as bandage to protect the cornea. Lower eyelid tapping. These measures are temporary. The congenital form may be treated by Hood's operation, in which a strip of the skin and muscle is excised. This is a photograph describing this operation. Another photograph of the same operation. The spastic entropion, we have to treat the cause of irritation, plus or minus chemodenervation by botulinum toxin injection. This could produce temporary or permanent relief. This is a photograph delineating the technique of botulinum toxin injection. The skin and muscle operation or excision of an ellipse of skin and orbicularis muscle may produce a permanent relief. Regarding the cicatricial entropion, we have different opinions for surgical correction. We have a very long list of oculoplastic surgical techniques to correct this condition. This is beyond the scope of undergraduates. Concerning the involutional or senile entropion, strengthening of the lower eyelid retractors is necessary. Don't forget to treat the secondary complications. For communication, this is my WhatsApp number. This is my email. This is the student page on Facebook. This is the Telegram channel. Remember to like this video, subscribe, enable notifications, share, and comment. Thank you and have a nice day.